Welcome to another presentation of Ask the Doctor. My name is Gurjeet Kalkat. I'm the Chief Medical Officer at Emanate, and I'm joined today by Dr. Mirza, who is an internal medicine physician practicing in Glendora. Today's topic is vaccines. We're going to focus specifically on 3 vaccines as sort of an update and discussion about influenza vaccine, RSV vaccine, and the shingles vaccines. Vaccines have played a very, very important role in the past 100 years. Actually, they are probably the most important contributors to a long length of life attained by individuals all over the world. So today we're going to discuss these 3 vaccines which play an important role for adults. So let's start with RSV. So Dr. Mirza, a few words about RSV.
Absolutely. First of all, thank you, and it's a pleasure being here. Thanks for having me. RSV is typically a virus that we associate with children, but what we're seeing now is definitely affecting the adult population at large as well. It is an RNA virus that goes on to produce not only upper respiratory infections, lower respiratory infections, along with other systemic complications as well. And to be honest, the major population that we're seeing in the adult population is those above 60, definitely above 75, and so we're trying to do our best to protect those populations in our practice today.
Yeah, absolutely. As he said, we used to focus on kids with RSV, but now more and more adults are having this disease, and actually we are recognizing this disease because we can do testing for it easier. Last year, 6,000 adults died of RSV disease, so it's very important to protect all the adults where we can. So let's talk about the RSV vaccine. So what kind of vaccines are available to protect against RSV infection?
Absolutely. What comes to mind, so there's about 3 vaccines on the market currently. 2 of them are not mRNA based, one is, but 2 aren't. And the 2 most popular ones are Arexvy and Abrizo. And so the first one is an attenuated vaccine, essentially. This is the one that we're targeting most of our adult populations. It's the most popular one, 75 and age above for sure, without any comorbidities. But those ones with about 60 age and above, if they do have some comorbidities like chronic kidney disease, coronary artery disease, asthma, COPD, even diabetes. These are the patients that we're targeting at a younger age, around 60 years or so, to get vaccinated. The other one is the Abrizo vaccine. So initially, this is also you can do it for the ones above 60, like the Arexa vaccine, but this one's also open to ages 18 to 60 or 59 or so who have severe immunocompromised states or ones that are more likely to get infected from RSV.
And it appears if you go on TV, most of the advertisements about Arexvy,
yes,
which is not a live vaccine, it's called a live attenuated vaccine.
That's correct.
So it's very important. So who is eligible to get RSV vaccines?
Absolutely. So the ones who are eligible, anybody who's over 75, regardless of what kind of comorbidities that you may or may not have. And then starting at 60, those who are high risk. So 60 with risk factors, like I mentioned, chronic kidney disease, asthma, COPD, diabetes, things like that, who are more likely to get this infection and have severe complications from it. And then anybody under 60, they can also get the other Abrizo vaccine, exactly, especially if they're immunocompromised or more likely to get very systemic or profound disease from getting RSV.
Yeah.
So that's kind of the population that we target.
Good. Yeah, in addition to the these disease states you mentioned, we want to emphasize immunocompromised patients who have transplants, patients who are on drugs which decrease the immunity, people with rheumatoid arthritis getting specialized drugs, that's just an example. So those are the target population to prevent the disease.
Yes.
And the vaccine is quite effective. It's about 80% effective, so much better than some of the other vaccines we will discuss later on. What is the ideal time to get an RSV shot?
An RSV shot, I would say definitely in the fall time before your other illnesses start to come about. I think September, October time, that kind of aligns with all the other vaccines that we give out, like pneumonia, influenza, and things like that. I think that's the ideal timing, right before you go into the season where other school children are getting sick, young population, especially with grandparents you're hanging out with, their grandchildren and things like that. I think that's the ideal timing, I would say. But again, getting the vaccine alone at any point is better than not getting the vaccine at all, I would say.
And what is the typical peak season for RSV infection?
It's typically in the winter season is when it peaks. I think that's when it kind of coincides. Like we mentioned initially, RSV is mainly a disease we used to think only affected children. And so if you think about when children get sick, when is the most time children get sick? Around the winter time, fall time, like right around that time as well. So I would say around that time is similar in nature.
December, January, or so. That's when it peaks. Yeah.
Exactly.
And then it's a shot.
That's correct. Yeah, it goes in your, usually we pick the upper arm, non-dominant arms in case it has a little bit of pain or anything to that area, but it's generally tolerated very well. There's really not much systemic side effects that we see. The most common ones we see are just mild pain or irritation of the site that they get injected at. And other than that, maybe some minor cold and flu-like symptoms, but they generally peak about 4 days and are self-limiting. We don't really need to do too much about it, and they do well.
Can we administer RSV vaccine with a flu vaccine at the same time?
Yeah, you can definitely get it with another vaccine. I would just choose a different arm to put the vaccine in, just so we can monitor in case one of the vaccines cause any kind of side effects, and also to make sure your arm isn't mad at you.
So that's about the RSV vaccine. The RSV, the illness itself is very similar to another cold, so it's very, very difficult to distinguish when somebody's having upper respiratory symptom that it's RSV or another virus. The only way to find out that you have RSV is do a testing. And for the testing, there are a couple of tests available. The most sensitive and specific test is the so-called the PCR. One may remember PCR testing for COVID-19, but those are the tests which can be done and can be requested by your doctor. So now we move on to the next vaccine, and that's the shingles or the zoster vaccine. Okay. So what is shingles? What is zoster is?
Perfect. Shingles. So shingles is this very unpleasant disease that you can get, which is a rash that can appear on your skin at any given time. And this is typically a reactivation of a previous virus that we were exposed to. A lot of people might be familiar with the zoster virus, and that's because they've heard the word chickenpox before, right? And so when you're young and you get chickenpox, and then all the spots go away after a while, the virus doesn't go away. So it goes and hibernates in one of your nerve cells for a little bit, and then as you age, certain triggers can come on in life, and all of a sudden it wakes up from its hibernation, and then a rash appears. And that's how we find out about shingles, is because it's quite unpleasant, and that's usually what our patients complain about, is the pain associated with the rash.
So essentially, as we age, our immunity decreases, and with the certain stresses, the virus reactivates in the form of a skin rash, and typically starting on one side of the body. Rarely goes to both sides at the same time, but typically can be arm, eye, all the way down to the legs. So that's classical, that it's a one-sided rash.
That's correct. And like you mentioned, just as we age, the reason it kind of surfaces at any given moment is because as you age, we lose immunity, and the loss of immunity is the #1 trigger to the reactivation of the virus. Although other stressors in life, other illnesses, things like that could all play a role in it, but overall it's the loss of immunity that causes the resurfacing of the virus.
Okay, good. What are the vaccines or vaccine available? I'm saying vaccines because there were 2 in the past.
That's right.
We've now come down to only 1 in America. So tell us more about the shingles vaccine.
Absolutely.
Who is a candidate for a vaccination shot for shingles?
Sure. Yeah. So there's 2 vaccines that, for shingles. One's no longer available in the United States. That's called a Zostavax. That was a previous live vaccine. The ones we do use in the United States now is called the Shingrix. I think that's what most people are aware of now. That's an attenuated vaccine, meaning that they add some antigens in there to promote a stronger immune response, to help build that immunity for shingles. And so the Shingrix is a 2-series vaccine. You get your first shot, and then you come back in 2 to 6 months or so to get your second shot to help really strengthen the immunity that we need to fight shingles. Typical candidates who get it are above 50 age or above, is our current candidates that we're promoting or wanting to get the shingles vaccine. So it's relatively easy to get.
And less than 50 will be the ones who are immunocompromised.
That's correct.
Whether they have steroid use or comorbidities or having transplants.
A very specialized population. It's available for them too. But your general adult population who doesn't have too many comorbidities or immunocompromised state or anything like that, 50 and above is the current guidelines.
So it's a dead vaccine, and it's given as a shot. one
2 series, yeah.
repeated after 3 to 6 months.
That's correct.
And side effects?
Very similar to like the RSV vaccine. Common ones are just pain at the injection site, maybe mild flu-like symptoms, but rarely do we get like hypersensitivity reactions. I think that's the only thing that might prevent you from getting the second shot is if you have a hypersensitivity reaction, but generally well tolerated amongst most of our population.
And does this have to be repeated every year, every 5 years, or no?
No, it's just the series of 2, and essentially that should be good for life. And also, if you've had a previous Zostavax virus, does not preclude you from getting you should still get the Shingrix, even if you've had the previous one as well.
You have to wait about a year or so to get it?
That's correct. Yeah, so if you have that, I would wait about a year. And if you've had a shingles infection or abruption show up like a rash, I'd also wait about a year to get your Shingrix at that point. So even if you had shingles before, I think you should still get the Shingrix vaccine.
And we can go back to RSV vaccine.
Yeah.
That's also done only once and not to be repeated for now.
Yeah, so that one exactly. For now, guidelines always change, but for now, once in your lifetime is the current recommendations.
All right, good. Next, we move on to influenza.
Yeah.
That's the most familiar vaccine we use for adults every fall. You have the influenza shots coming, ads coming at you from everywhere. But it's important to get vaccinated. So influenza vaccine is important because it has to be repeated every year. And why every year? Because the virus mutates, because it changes its character. So the previous year's vaccine or infection will not protect you for the following year. So going to the vaccines, what kind of vaccines are available for influenza?
So on the market now, there's definitely more influenza vaccines available than the other ones currently. So there's about 6 or so influenza vaccines that are currently available. The ones that most of us are familiar with is probably the first one, which is a standard dose inactivated influenza virus vaccine. This is just basically available for anybody who's over 6 months of age. So your general adult population can receive that. Your kids can receive that as long as they're above 6 months. The next vaccine is the high dose vaccine. So the difference between the first one and this one is that there's 4 times the amount of antigens that's available in the high dose. And this is mainly geared for our adult population, elderly population above 65 age or older, just so they can have the extra strength immunity to really help fight off the flu season. Then you have the recombinant one. And so the recombinant one is favorable for our population that might have allergies to eggs, because some of these vaccines are made with egg preservatives and things like that. And this vaccine is available for those with egg allergies from age 18 to about 65 or so. And then moving from there, we have the intranasal one. So this is kind of different than the other vaccines.
Yeah.
And
the intranasal one is live, actually.
it is. It's live, and so, but it's weakened. It's not the actual. It is the virus, but it is very weakened. So the virus is in a state that it cannot go on cause influenza, systemic complications from influenza. It is a weakened version of it. So I don't want any kind of discrepancy there.
And what's the age limit for the nasal vaccine?
So the age limit, you have to at least be 2 years of age, and then below 50, so 49. So 2 to 49 is the target population for the intranasal vaccine.
So for our adults over 65, or adults, mostly it's the standard dose.
That's correct.
And over 65, the high dose, because they have a weakened immune system.
Absolutely.
So, and what's the best time to take the vaccine?
The best time is September to October. I think that if you get vaccinated around September, October, you really increase the length of immunity that you get throughout the entire flu season. Mm-hmm. But then again, like I mentioned before, it's better to get it than never at all. And so even if you, for whatever reason, have to get it in October or November, I would still get it. I would still recommend it just because you still have the immunity. Maybe you just missed a few months in the beginning, and that's about it.
And you mentioned, egg-free or for folks who have egg allergy. Mm-hmm. So we have a lot of choices now that you have egg-free vaccines. So that should not be an issue for folks who have egg allergy.
Exactly, and people who are vegetarian or vegan and things like that, there's different options, like for the egg-free ones, preservative-free ones as well, and things like that, yeah.
We hear that sometimes influenza vaccines is only 40% efficacious. And it's important for the public to understand that we manufacture the vaccine based on a previous year's infection in the Southern Hemisphere. It's sort of an educated guess in the month of February that what are they going to prepare the vaccine with, what kind of strains they're going to have in that vaccine. But even though it's only 40% efficacious, people who get the vaccines will not have a severe disease as compared to folks who do not get this vaccine. Any other comments about influenza vaccine?
Everybody has an opinion on that. I think it's great to hear all these opinions. But at the end of the day, like you mentioned at the very beginning of the podcast, that vaccines were probably one of the most important things in the medical world and things that we really cherish as physicians, like to help prolong life and longevity of life to our patients abroad. So I think that getting educated and really knowing what vaccines can do, and for you and your loved ones, I think that's quite important. So I think it's very helpful and it's wise to get vaccinated.
Thank you very much, Dr. Mirza. Appreciate you coming over and telling us these important issues about these 3 vaccines. Dr. Mirza is practicing in Glendora, as I said before. He can be reached at gmirza@emanatehealth.org. And that's all for today. Thank you for joining us.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos.